Dr. Jonathan Hadley. I'm a radiologist at East Alabama Medical Center. Calcium scoring scan is a non-invasive CT scan that allows us to look inside the body at the heart to see whether there's any hardening of the arteries, if there's any calcium that's built up inside the vessels, and gives us an idea of what your risk is relative to other folks for future heart attack. Calcium scorings typically are done on patients who don't have any symptoms. Men over the age of 40, women over the age of 45. Patients who don't have any symptoms, we want to evaluate them because the most common presenting symptom of heart disease, unfortunately, still today, is sudden death. And so the only way that we can identify people who have coronary disease and actually treat them is to screen for them. And our best screening test right now is the calcium score. The scanning process itself is very simple. It's completely non-invasive. You don't have to have an IV. Basically, you'll come to the imaging center, be brought back to a machine such as this. They'll have you lay on your back, hook you up to an EKG, and scan you. The whole process takes just a few minutes. It's painless. And at the end of the procedure, you'll get a printout of your score. And when you leave here, you'll know exactly what your calcium score is. Hopefully you'll have a 0 score. That's the only normal score that there is. If you have calcium buildup, the overall amount of calcium that you have will give us an idea of what your risk is. These scores can go up into the thousands. Patients who have scores that are above 400 are going to be recommended to follow up with a cardiologist. Most patients will have scores that are under 400 and will be able to follow up with their primary care doctor and be treated medically, usually with something like a statin or maybe aspirin. And you'll probably get a follow-up calcium scoring in 3 to 5 years, depending on whether or not you actually have calcium present in your vessels.